Hi, my name's Elise. I am a university student doing a double major in diversity and social justice studies and social psychology, quantitative social psychology. I also have relapsing remittent multiple sclerosis and recovering from DRESS syndrome, which is a severe drug reaction with systemic symptoms, and they think I have Graves' disease. I recently was at a conference and was talking about being a university student and having multiple sclerosis and all of these health issues. And afterwards, a woman came up to me and I just kind of thanked me because someone she is related to was recently diagnosed with MS, and a lot of people kind of view it as a death sentence. But I guess it kind of helped her to see all of the things that I was doing, and I think it's important to acknowledge that not everyone, multiple sclerosis, all chronic illnesses, affect people differently, and not everybody can do the same things. But to have the hope that not your entire life is over, I think is beneficial. It made me remember when I was first diagnosed, an optometrist was talking to me, and she had kind of facilitated the initial diagnosis. And she said to me, "Oh, I know a woman who's in her 80s who has MS, and she isn't any worse off than any other person in their 80s would be. Like, obviously, she has health problems and issues, but it didn't take over her life, her whole life. It didn't affect her whole life. She was still able to do things that she wanted to, maybe not everything, um, but I think it's also important to acknowledge that not everyone can do everything they want, regardless of ableness or able-bodiedness. Yeah, so I guess I'm starting this YouTube channel I'm going to put up um, occasionally because I just want people to kind of know. I want more awareness. I want people to know that just because you have MS doesn't mean you can't do anything. There's still things that you'll be able to do. You might have to change things that make you happy, but your life isn't over. And I think just want, if anybody else is struggling, I know there's other people who have multiple sclerosis who are in university, other people with chronic illness who are in university. I think I'm very privileged in that the school I attend is amazing for accessibility services. I definitely lucked out, especially having talked to a lot of other people about their experiences at their university and the accessibility or lack thereof of support services. I'm definitely very grateful and very beneficial. I'm privileged to be going to the university that I'm going to. Fun fact, it's also one of the cheapest universities, which is really helpful, especially now that I maxed out my drug insurance and I'm paying for most of my medications myself. Um, yeah, another, at the same conference I was at, and the woman came up to me, we had to do this kind of explaining about ourselves and our past with other people kind of in our cohort. There are 10 of us. And something I said is, when I started talking, and I kind of preface it a lot, I didn't do it in this video, is that I have dysphagia and paraphagia. So I sometimes forget the words that I want to say, and sometimes the words I want to say aren't the words that come out. You'll notice I tend to speak fast. There seems to be less of that if I speak really fast. If I pause, I lose words more easily. And one of the guys came up and talked to me and said that that kind of made him want to become a director, something like that. Because there's all these people who have these stories who there's something preventing them from telling their stories, like a part of who they are. I used to be an amazing public speaker. You'll notice I say and a lot. See? But I think we sometimes let ourselves hold ourselves back and let society hold us back, just based on what they think we can accomplish and what we believe we can accomplish, based on what we've heard from other people, maybe just shortly or all of our lives. So I think it's really important for people to talk to each other. And I just noticed the light in the background is very bright. I turned away because there's a window on the other side, and it was very bright. I wonder if I can turn it off. Oh, that's better. Yeah, so I'm pretty much just going to be talking, maybe ranting. We do a thing called rants and raves at my school where people get up and rant or rave, usually rant about things that annoy them or piss them off. Um, and it's really good. It builds a really good sense of camaraderie and helps people understand that life isn't peachy keen for everyone. Everyone has their own struggles, even if you don't see them. I don't look like I have an illness, although I'm sure I'm on 10 milligrams of prednisone. I just went up from 5, so I'm sure I'll get a puffy face again, which tends to make me look sicker or like something is off, because I have these like huge chipmunk cheeks, which I don't currently have because I was down to 5 milligrams of prednisone for a couple months. Yeah, hopefully I don't get the rage again. But yeah, so I'm going to talk about just life as a person who has a chronic illness. My experiences are my own. They in no way reflect the experiences of everyone with a chronic illness. Like I said earlier, everybody's different. Chronic illness affects everybody's lives differently. I think something that's interesting is people see all of the things that I do and all of the activities that I'm involved in and think that's wonderful. And I really am not, hopefully not in an inspirational porn kind of a way, but in a way that people see it as like, oh, like she has a chronic illness and she can still do all of these things. That's so amazing. But the underlying root of that is I'm terrified to stop. If I stop, I'm scared that I'll get sick. So if I go constantly, it's like my body doesn't have time to get sick, which hasn't really worked out. I think my body keeps giving me sicknesses to tell me to slow the frig down. And I try to listen, but it's a work in progress. But I think it's important to understand the reasons why people do certain things. I think it's easier for me to get out and do something when I feel horrible than lay in bed, because my mental health suffers, because I have to kind of admit to myself that I'm not the person I was before the Dress syndrome and the MS. Dress syndrome seems to be affecting me the most. Well, I guess Graves recently has been affecting me the most, which actually was kind of a blessing because all of the symptoms that I had, I blamed on the MS, even though I wasn't supposed to be experiencing a lot of MS issues because I was on prednisone for so long. I've been on it for about a year. I was on 120 milligrams for almost 2 months and then slowly tapering down. So I have all of these things that I kind of blamed on MS. I'm like, I'm having trouble walking. It must be the multiple sclerosis. I'm having even more trouble with words. It must be the multiple sclerosis, because there are things that kind of wow, kind of affected me a little bit previously, but I never really paid attention to them. But now they've become a big part of my life. Like I can't go upstairs without bracing myself, and it hurts like heck. And I face planted a bunch of times. So to kind of find out that my leg problems are probably muscle weakness from hyperthyroidism, and like the dizzy spells are probably from the hyperthyroidism. Hyperthyroidism has some decent cures. There's medication and radioactive iodine and surgery. So there's all of these things that can help it that MS doesn't really have. Like we have medications, we have amazing, slightly terrifying to me, medications that have helped a lot of people. But they're not, I guess the success rate isn't as kind of guaranteed as if you get rid of your thyroid, you won't have hyperthyroidism anymore. But yeah, it's not necessarily the best option, but it's kind of nice to know that an end is more in sight. So I am going to let you go for now. I will keep you updated. I'm apparently going to start radioactive iodine treatment when I get back to the province that I live in. I'm currently at my mom's. Um, so yeah, and I'll probably at some point rant about the education system. I kind of did that a bit at the conference I was at. I'll probably post kind of an adaptation of the speech that I gave about the importance of decolonizing the institution in order to benefit everyone, like Indigenous people, people with accessibility needs, even just people just anyone. Yeah, so until next time, bye.